Welcome back, class. This second voiceover for the postpartum lecture is going to cover transition to parenthood. All the different changes, emotional, psychosocial, that occur after a baby's born.
The transition to parenthood is exciting but stressful even in the best of situations. The way a person approaches parenthood has been molded by personal values, cultural beliefs, and societal expectations. The knowledge of the expectations and responsibilities is acquired formally and informally. Formally is called intentional learning. That's the parents who pick up the books, or they go to attend childbirth classes or infant care classes. Incidental learning, the informal, this is observing others in the role and learning what they're doing. You watch your friends who have babies take care of them and watch how they're changing diapers, burping, feeding, for example. Other factors that can influence the transition to parenthood includes how the parents themselves were raised. What type of relationship exists between the partners? Is it supportive, not supportive? Are two partners involved, or is it just the mother? Financial concerns are stressful. Other factors include the educational levels of the parents, the support systems available to them, their desire to be a parent, and the age of the parents as well. One of the original theories on maternal identity was developed in the 1960s by Reba Rubin. She discussed there being 3 phases in the process of maternal role attainment. These 3 phases were taking in, taking hold, and letting go. That taking in phase is usually the first day or so post-birth, where the women are really more dependent on the nurse. They have difficulty making decisions for themselves. They focus on meeting their personal needs. They're excited, they're talkative, they need to talk about their birth experience. It's a dependent phase. The taking hold phase is after the first 1 to 2 days postpartum through the first few weeks. The woman is becoming more independent. She's actually focusing on the baby care, and improving her caregiving competency. She wants to take charge, but still needs some encouragement from others and acceptance of her in her new role. Sometimes she's dealing with the physical and the emotional discomforts because this is around the same time that the baby blues traditionally hit, which we'll talk about later on in this presentation. The third phase, the letting go phase, is when the woman moves into the new role of motherhood. She's not independent, she's sort of interdependent. She still relies on her partner and the support systems, but the focus turns to the family unit as a whole. Her resumption of roles that she held previously, intimate partner, an individual, professional roles that are now incorporated with her new role as mother. Becoming a father evolves over time, just like motherhood. And the reality of becoming a father may not occur to men until the child is actually born. Usually in their mind, they picture their child more as a young child, 4 or 5, maybe older. They don't think of infants and babies. The meaning of fatherhood varies according to the man's interpretation of the role, its expectations and responsibilities, often, again, influenced by what he experienced as a child and role models that he has seen. One pattern of paternal transition to parenthood talks about stages that a father would go through as he adapts to his new role. And the first stage would be expectations and intentions. The father desires to be deeply and emotionally connected with the infant. And then he confronts realities. he discovers that his expectations might not be met. He might feel sad, frustrated, or jealous. Then he'll embrace the need to be actively involved. The father decides to become actively involved in the care of the infant. The father will then reap the rewards of his emotional involvement. He'll see the baby responding to his presence, to his touch, to the sound of his voice, and it gives him a sense of completeness and meaning. Not all births are to traditional family units. The birth of the newborn can be a very challenging time for adolescent parents who are working on adapting to these challenges of caring for an infant and developing their maternal and paternal roles, while also working through the developmental tasks of being a teenager. And unlike adults, they have very few life experiences or coping skills to fall back on. Add to that, most times adolescent mothers live with their parents, and the father of the baby does not live with the mother in the grandparent's home. This can impact bonding and attachment. Same-sex parents, particularly lesbian couples, have decisions to make prior to birth. Who will carry the baby? How will they conceive? Once the baby has arrived, most lesbian couples view themselves as co-parents. They're going to share in everything. Not necessarily equally, but they're going to share and work together to care for the newborn, raise their child. Both the childbearing and the non-childbearing mother can breastfeed. Always ask what the plan is because each will have different needs. The initial 4 hours after birth are known as the fourth stage of labor. It's during this time that mom will need frequent assessment, the infant will be needing frequent assessment, but also this is when bonding and attachment are going to be occurring as well. After the birth of baby, if the baby is stable, it'll be placed skin to skin with the mom, and you will see both mom and family members starting to take an interest in the infant and starting to express emotions. Several factors affect both bonding and attachment. Time, proximity, whether the pregnancy was planned or unplanned, and the ability of the parents to process through the necessary development task of parenting. Now, what's realized to be better for the baby both physiologically and emotionally is to be skin to skin with the mother, ideally for at least 60 minutes right after birth. Everything other than checking the baby's vitals while the baby's laying on mom's chest will wait until after that first hour so that they have that time to start forming their relationship. Nurses will be assessing bonding and attachment from the moment of birth through discharge. You're going to assess for behaviors that facilitate and indicate mother-infant bonding. So you're going to be looking at, as the mom talking about the newborn as part of the family, she doing the end face, the face-to-face contact, looking at the baby's in the baby's eyes. Is she responding to the infant's cues? You also are assessing for behaviors that impair bonding and indicate a lack of mother-infant bonding. Apathy when the baby cries. She expresses disappointment in the infant. Maybe perceives that infant behavior is uncooperative. Or she even limits close contact with the infant. Another assessment would be looking at emotions, mood swings, conflict about the maternal role. Does she feel personally insecure? Does she feel inadequate? Does she have a flat affect, look withdrawn? Is she emotionally labile? During those first 4 hours postpartum, you're going to notice the changes in the way the mother touches the baby and handles the baby. The first stage of maternal touch is when the mom is like fingertipping the baby. She's tentatively touching different areas with her fingers, exploring. During the second stage, she becomes more comfortable and she'll use her hand, her full hand, to stroke the baby, the head, or the back, or their tummy. And then in the third phase, when she really wants to get to know the infant, she's going to hold the baby in her arms, bring the baby close to her, and look at the baby eye to eye. This is called end phase. Now the nurse can model these behaviors during the hospital stay, especially for a mom who's showing signs of poor bonding and attachment. When the nurse is assessing the baby or carrying the baby to the mother or changing a diaper, she can model some of these behaviors for the mother. Over the last 50 years or so, you have seen fathers become more active in the labor and delivery process, the birth process, and the immediate postpartum care of mom and infant. Early presence of the father allows him more time to get comfortable touching and holding the infant, which makes him feel more active as a member of the family, which increases the level of bonding and attachment. So new fathers experience intense preoccupation about and interest in their infants. And this has been labeled engrossment. And this is when the father, he just wants to soak it all in. He's watching the baby's every move. He's touching the baby. He's listening to all the family comments of, oh, who does he look like? What are the distinct features? And is affected positively by that. He does have the perception that his infant is perfect, and that gives him feelings of great joy and helps increase his self-esteem. Early contact between parents and infant fosters attachment. It lets the infant and parents learn more about each other so that they can become more aware of the cues that each makes in response to the other. This is called reciprocity. It's an inherent rhythm that exists between parents and an infant, and it becomes stronger with each interaction and the passage of time. Some of the cues that you learn from the infant are the different types of cries. Is the infant crying because they're hungry? Are they crying because their diaper's wet? Are they crying because they're tired? Over time, the parents will hear the subtle differences in the cries, which will allow them to decipher what the baby actually wants. And this is how the communication between the parent and child will go. Other common communication cues used by infants are on your slide. Family dynamics are the unique ways in which family members interact and participate within the family. And there are many different types of families and family compositions. You have married couples, non-married couples, adoptive couples, blended families. You have parents who stick with traditional roles versus co-parenting, where the parents or the parental figures work with each other, and even though the work isn't 50-50, they have and agree to these shared relationships that support and coordinate with each other. The unique concerns of multiparents, or women with more than one child, are that they might have the knowledge and the practice because they've had children previously, but now they're usually have less help and they're going to be more exhausted. Then you have the case of sibling rivalry, where the siblings of this newborn realize that something's changed here, and they might not necessarily like that they don't have as much of mommy or daddy's time and attention. Your book provides you with specific examples of nursing actions for parents who are visually or hearing impaired and parents with physical impairments. What you need to do as the nurse is to make sure that their education is maximized to their ability levels so that they can independently care for their child. Culture also plays a big role in how a family works together and the roles and relationships. You have some ethnicities where by tradition it's a female led household versus a male led household. In some countries, the women are expected to do nothing after delivery of the child. The family will take care of the infant, and the mother will rest and recover for the next 4 weeks or so. With the increasingly diverse patient population, it is imperative that nurses provide culturally sensitive care. Professionals must acknowledge belief and value systems different from their own and consider these differences when delivering care to new families. The transition to motherhood isn't easy, and most women, to some extent or another, will experience the postpartum blues or baby blues. It usually occurs in the first few days to weeks postpartum. It only lasts a few days. Sometimes the symptoms can come and go. One day you're feeling good, next day you're not. It's only natural when you consider all the physiological and psychological, family and social changes that we've talked about over the past 2 voiceovers. But the mom is still able to take care of herself and the infant. If the sadness lasts for more than a few days, or the mom starts to neglect self-care and or the infant, postpartum depression may be developing, and the mother needs professional follow-up.
Remember, if you have any questions, feel free to email me at my Maria College email address.